Colleagues, ladies and gentlemen, first of all, I would like to thank you for the invitation. I'm really honored to be part of this very important day, not only for Spanish health policy, but for the entire European Union. And with my introduction lecture, I would like to address the importance of cardiovascular health in Europe, progress and needs. So I'm very grateful to be here today in a country that is leading the way on cardiovascular health policy in the European Union. The Spanish cardiovascular health plan not only will be crucial for improving the health of people in Spain, but is already acting as a symbol for many on what we aspire for. So Poland has recently launched a cardiovascular health plan, and it is our hope that Germany and Czech Republic and Ireland will soon follow. But clearly, Spain is on the lead here. So breakthrough treatments, summarized here on this kind of busy slide, enhanced understanding of cardiovascular conditions, changes in lifestyle and tackling of risk factors all contributed to this miraculous decrease in mortality that changed the world and society as we know it. That success, however, brought a decline in cardiovascular health prioritization. National action plans lapsed and were never revived, investment dried up, and funding slowly declined. So, in a way, we have become victims of our own success. And so this is the result that you can see today. The EU's biggest killer, confined to an afterthought in most public budgets across the European Union. Hard-fought gains in reducing mortality are on the brink of being undone. And last year, the EMA approved 17 new medicinal products. Not one of them was to tackle the EU's biggest killer. As you can see on the right, cancer way on top, cardiovascular accounting for the highest number of deaths, being very low on investment. So this lack of investment is currently felt on the ground by our members. So this survey conducted just last month of our national cardiac societies showed that 69% viewed limited funding as a major challenge in cardiovascular care. So let's look at some highlights that may be not well understood in the public. First of all, it's not only about elderly population being a reason for remaining high cardiovascular death rates. No, it's premature death also that is the biggest problem and has the biggest part for the biggest cause for death in premature deaths. So here you can see that 29% of females and 33% of male deaths are due to cardiovascular disease. So I think this is one important message that we have to convey to the public when addressing the cardiovascular health plan. Also, we're still not good enough in tackling the most prevalent risk factors. Smoking, for example, despite policy to ban smoking in public places, we still have a median of 22% of the adult population in Europe over the age of 15 that are regular daily smokers, and we have a wide array. It's less than 10% in the northern countries, but more than 35% in southeastern countries of Europe. And so these are kind of data that you can actually look up in the ESC Atlas, which is an important data collection activity that we have in our Brussels site of the ESC, and that you can access now recently in a relaunched website. And of course, obesity can be regarded as the pandemic of the 21st century regarding cardiovascular disease risk. So the median prevalence of obesity across ESC member countries is above 20% and is still rising. So more than 1 in 5 people are obese, and it's a major risk factor for cardiovascular disease, and of course, entailing other important risk factors such as diabetes and high blood pressure that is still very prevalent with 27 and 22% in men and women, respectively. So this slide shows the most recent numbers. Actually, the proportion of cardiovascular disease accounting for the national causes of death in the EU 27 countries. So it's 40% in females, 34% in males. So again, it's more prevalent in females than in men. And if we compare the Spanish numbers, also can be retrieved in the ESC Atlas data, and actually national cardiac societies have contributed very much to this data collection. You can see that you are lower than the median of the EU 27, and this is known that southern countries have a lower prevalence of cardiovascular disease. Nevertheless, still the leading cause of death also in Spain. So public understanding of these kinds of statistics is low and brings us to our first need. So here's a test. Simply do a Google image search for heart disease patient and then Google cancer patient. Compare the two. For cancer, you will see images of young people, women, and young children. For heart disease, almost exclusively older patients. These may not be the best examples, but this is just not borne out by reality. A key challenge we must overcome is to show the reality of cardiovascular disease to the public. Cardiovascular disease kills more women than every single cancer combined. It is the single biggest cause of premature death across EU and is the biggest killer of infants under the age of 1 year old. That is what the data actually show us, and perhaps the biggest challenge we face today is to create a public understanding of this reality. Now, cardiovascular disease has major inbuilt inequalities, but is also reflective of inequalities we see in society in general today. Geographic, generational, and gender, each inequality can be seen in cardiovascular disease. We see it in countryside versus cities, Western versus Eastern Europe, and perhaps none more so in men versus women, and this is shown on this picture. Today, more women than men in the EU die from cardiovascular disease, a 6% difference, and yet they represent less than 1/4 of clinical trial candidates. So the very treatments that are being created are not tailored for those most likely to need them. If we want to be serious about cardiovascular health, then these inequalities need to be tackled. So for those of you who have been active in advocating for cancer care, you can continue the fight by incorporating cardiovascular care. So this shows a new field in cardiovascular medicine, a kind of a subspecialty almost in our society in the ESC, cardio-oncology. So as you can see, for example, a 24-year-old cancer survivor today has the same incidence of severe cardiovascular conditions as their 50-year-old siblings. cancer therapy, in effect, can double the age of someone's heart. So such is the strain placed on the heart by these novel cancer treatments. So cardiovascular disease today is the leading comorbidity of those undergoing cancer therapy. And this is a very important fact that has led to this subspecialty endeavor. So by having a greater focus on multidisciplinary studies, on cardio-oncology, we can save lives in cancer and cardiovascular disease. So what else do we need? More evidence on environmental risk. And here you can see that one example that has recently emerged. So among almost 800,000 excess deaths that are attributed to air pollution in Europe every year, almost half of these deaths are due to cardiovascular disease. And this fact has prompted the European Society of Cardiology to, for the first time, express a very high recommendation, Class 1 recommendation, to place measures to reduce air pollution, including emission gas and gaseous pollutants and carbon dioxide emissions, to reduce cardiovascular mortality and morbidity. So increasingly, air pollution and other kinds of pollution are well-documented risk factors for cardiovascular disease. Now, the impact of cardiovascular disease is felt in all aspects of our lives, and so must be felt in all aspects of policy, from transport to employment, from agriculture to research, from equal right to climate change. Cardiovascular health is affected by them all. This is a bit hard to read, but you know, the very air we breathe, the conditions of our planet are all telling us something about our cardiovascular health. When we look at a climate change policy, for example, we know, and this paper addresses this, that a 1% increase in temperature leads to a 2.1% increase in cardiovascular-related mortality. So to be successful in reducing deaths from cardiovascular disease, we must adopt a cardiovascular health in all policies approach. So a transsectoral policy is needed here to more effectively tackle these problems altogether. So for those unfamiliar, a major conversation has started at EU level, the European Health Data Space, that will shape how health data is shared across the European Union on a scale not seen since the GDPR. But, you know, the question is, what kind of data will we have at our disposal? Will it be the kind of quality that will form the basis of next breakthrough treatments? Or will the EU become a leading trader in junk data? How we avoid the latter and ensure the former is by proper funding for cardiovascular disease registries across the Union. Even the most sophisticated legal framework for data sharing will be useless without the infrastructure needed to support it. So by funding cardiovascular disease registries at a national and EU level, we can aspire to the next breakthrough treatments. So this event will take place soon in our Brussels office. I say again that Spain is the exception to the rule. Less than 1/3 of ESC members report that they have funded cardiovascular health plans in their country, seen on this slide from our recent survey. So we need to be driven by evidence-based policy. What healthcare issue could be more important to champion than the biggest killer in every single EU member state? What cause more key to sustaining economies, then the conditions that represent the highest burden of disease. So in the coming years, with your help, it is our hope that this chart will tell a different story, hopefully. So, as you have seen, we have a lot of needs, but above all, we need you. Via the Spanish Cardiovascular Health Plan, you have already got the ball rolling. It cannot be just the ESC and our Professor Bueno waving the Spanish flag in Brussels and champion your success. We need the voice of the Spanish ministry and government in the European Council, leading the way for other member states to follow. That's very important. So you have done such important work already. Please don't stop. And again, congratulations on launching the Spanish Cardiovascular Health Plan. Thank you so much for inviting me.